And as many of you know, not only have they been on the front lines, but so has Milwaukee County, with providing many critical services for those in need. And we have over 950,000 residents here in Milwaukee County, and our government departments have served the most critical and high needs areas of housing, our Department of Health and Human Services, mental health, as well as coordinating a countywide approach to fight the COVID-19 with the Unified Emergency Operations Center and the Emergency Operations Center. Before COVID-19, we knew that the critical services that Milwaukee County governments are often, it's an invisible layer of government that we provide to our residents. And so we've seen in the previous administration how costs have been cut. We've seen more money going to the state than we received back. So we know that our budget is going to be a little bit tight. And so with the disparities with COVID-19, we know that we're going to need more resource for county services. And so really looking forward to working with the state legislature as well as the governor's administration to bring that much needed resources back. But also excited to say that we're going to see an increasing in testing next week. I've been working with the city of Milwaukee, Mayor Baird, as well as the governor's administration, Governor Evers, to see an increase in testing. And so you're going to see a lot more of that happening. We know that we need to test as many people as possible to stay as far ahead of this as we can. And so I'm excited to see what is to come, and looking forward to hearing from everybody else.
Thank you, County Executive Crowley. And next we'll hear from Milwaukee Mayor Tom Barrett. Please go ahead.
Thank you very much, Brian. And I too, just as the county executive did, I want to pay tribute to our nurses. They are the ones that are there day in, day out, oftentimes in the middle of the night when our patients need care. And I think that this is a time where we all recognize the importance that they bring to our society. And because it's National Nurses Week, it is absolutely the most appropriate time for us to pay tribute to them and to thank them for their service to all of us, whether they're working in physical health or mental health, whether they're working in a hospital, in the community, whether they're working in a nursing facility. They obviously are people that really put their lives on the line right now, as we see when we read about the challenges that they face dealing with people with this highly contagious disease. So I want to thank them. I also want to echo what the county executive said. We've had some very productive talks among the county, the city, the governor's office, Department of Health and Services at the state level to have greatly expanded testing here in Milwaukee. This is something that the state's worked on in other areas, and they're very, very interested in partnering with us. A couple of reasons why this is important. We know that we have to have more testing. We know right now that the capacity is there, and we've talked over the last several weeks about the increased testing capacity that's available through our community health centers. And we continue to urge people, particularly if they show symptoms, to contact our community health centers, to contact their health care provider, to contact 211 if they need to be tested. But we want to do even more. And so the National Guard, which has been a phenomenal partner throughout this entire 2-month ordeal, is really stepping up in a significant way. Our fire department has also begun to do some assistance in testing. They've been at some of our healthcare centers this week, and we think that that's very important. But we want to greatly expand this. Now, it's going to require two different things. One is we have to make sure that our hospital systems and other healthcare providers are responding to our requests that there is a medical home for individuals who test positive. That doesn't mean that they're going to go into a hospital, but we don't want it to be a situation where someone tests positive and we simply give them the slip of paper saying you've tested positive. We have to take that next step. To be referred, whether they get be connected, I believe, with a healthcare provider. And we've made significant progress in this area, but particularly as we move to community testing, there's still more work that needs to be done there. And what we're talking about for next week is we are talking about much more widespread community testing. I think the other detail that needs to be worked out is going to be the level of criteria, whether it is the symptomatic, which is what we have been doing for the last several weeks, which is very, very important, or whether that gets expanded in some fashion. And I know Dr. Weston has some strong beliefs on this and some understanding of this, as does Director Christensen. So they may want to talk about that, how we're making adjustments to that and whether this is the way to do it. But but we welcome the opportunity very much so to partner with both the county and with the state of Wisconsin to have more testing, because we know that that's key to this. The final point I want to make is the epidemiologist today just released the report on voting, in particular the voting that occurred on April 7th. What we know is that there were 56 individuals that tested positive, whether they came in, and it's in two different categories: individuals who tested prior to April 7th and those who tested after April 7th. Again, 56 individuals. Some will say that's a lot, some will say that's not many. The one thing that I will say with certainty is, please don't make us go through that fiasco again. What happened in Milwaukee was a marriage between our health department and our City of Milwaukee Elections Commission, where we put enormous resources into making sure that every one of those sites, and that's part of the reason that we had significantly fewer sites, was we had to make sure that we had a health department presence so that they could be very, very clean. That is going to be much more difficult to do if there are a greatly expanded number of sites. And that's why we're continuing to push for the mail-in option. We think that that's very, very important. And also to give us the flexibility to get the ballots after the election day. Unfortunately, in this election, we had to have both the Federal Court of Appeals, the District Court, and the United States Supreme Court make the decision that we could accept those ballots after the close of business on the election day. I'm hopeful that the legislature is not going to make us go to court again to have that happen, but that remains to be seen. So again, a lot going on, and we're pleased that so many people are working together. And with that, I'm going to turn it over to Dr. Weston. Doctor?
Thank you, Mr. Mayor. Good afternoon. So first, to our numbers, we have 3,544 cases of COVID-19 in Milwaukee County, and now over 200 deaths, with 201 individuals who have died from COVID-19. Our frontline workers, and in particular our nurses, recognize and live each day with the concern and strain that COVID-19 places on them, both personally and professionally. Considering the seriousness of these issues, I think it's worth ensuring that everyone has a clear understanding of COVID-19 and why it's such a concerning illness. There have been and continue to be many comparisons of COVID-19 to seasonal influenza or flu. These discussions often start with statements about why we're taking all these precautions with COVID-19 when influenza kills tens of thousands of people nationally each year, close to the current count of COVID-19 deaths, although it has surpassed that. There's certainly some similarities between typical influenza and COVID-19. They're both viruses. They both start with similar symptoms: cough, fevers, body aches. They both spread person to person through droplets in the air, and both can be prevented in similar ways through hand hygiene, covering coughs, covering sneezes, and avoiding contact with those who are sick. However, there's key differences between the two that are critical in understanding and framing the conversation on why COVID-19 has led to social distancing, to surge planning, and a frantic pace of treatment and vaccination development. So contagiousness is one key difference. So a person with influenza typically spreads the disease to just over one person on average, whereas someone with COVID-19 spreads it to 2 to 3 people. It may not sound like much of a difference, but if you go through 5 generations of spread, which happens pretty quickly, influenza may go from 1 person to 5 people, whereas in that same time, COVID-19 would spread from 1 person to over 30 people. And this is further complicated by the fact that while influenza is most contagious while you have symptoms, one of the most contagious periods with COVID-19 is actually before you even develop symptoms. So you can much more easily spread the virus unknowingly for days before you have any sort of symptoms or feel sick at all. Second, death rate is another important difference. So influenza nationally claimed as many as 60,000 lives this year over about 7 months. COVID-19 has killed more than that in less than 3 months and continues with more deaths as we see each day. Another critical difference is treatment and vaccines. There is an effective antiviral for influenza and an effective vaccine, though underused, for influenza. Neither of those currently exist for COVID-19. Additionally, while influenza has seasonality, it's mostly in the winter, it goes away in the summer, There's no signs of seasonality when looking globally at COVID-19. Importantly, all these figures, the number of cases, the number of hospitalizations, number of deaths, have taken place with COVID-19 under fairly strict social distancing, while influenza transmission took place relatively unchecked. And that is to say, while it may be tempting to conclude that the number of influenza deaths are similar to the number of COVID deaths, due to the significantly higher infectivity and mortality of COVID-19, were it to have spread under similar circumstances as influenza, the death rate would undoubtedly have been far, far higher. And perhaps most concerning of all, while influenza comes and goes with the seasons and is tempered, as we said, with a vaccine and antiviral treatments, COVID-19, with its higher level of contagiousness, its increased need for hospitalization, its increased rate of death, is not going away anytime soon. The fact that COVID-19 will likely be with us for at least a year and likely longer should not create fear, but instead it should foster preparedness through increased testing availability, increased tracing infrastructure, hospital capacity, and interagency cooperation so that we can start to scale back social distancing while being ready for what may come. So our healthcare workers, our nurses, are aware of that threat that COVID-19 places on them and their loved ones every day when they go to work and when they come home. And so we'll honor that work by continuing to move forward in a measured and responsible way to prepare our community for the months to come. And as part of those efforts, as the mayor and the county executive mentioned, we're expanding our access to testing sites. We now have 17 testing sites open throughout the county that will test individuals with symptoms. You can call 211, regardless of your insurance status, your income, your immigration status. They will connect you to a nearby testing site. Thank you very much and stay safe. And I will hand it back to Brian.
Thanks, Dr. Weston. And next we'll hear from Ann Christensen, who's the Director and Health Officer for the North Shore Health Department.
Thank you, Brian, as well as the other speakers today. It is an important day for us to celebrate our nurses, and I would be remiss if I didn't give a shout out to our public health nurses. They're a really unique type of nurse in that they sit in the health department, and they may be the contact that you have after your provider gives you that determination of your test. And those public health nurses, again, are really there to help you manage the course of your illness in terms of checking in with you daily to find out how you're doing. They may, if symptoms are getting worse, they may recommend that you contact your provider. In some cases, they may recommend you call 911 for emergency treatment. Those public health nurses are really on these front lines in different ways than clinical nurses, but really supporting people with COVID-19, as well as those who've been exposed to COVID-19 throughout the course of their isolation and or quarantine periods. So again, our public health nurses are really true heroes from the public health system, and we're very happy to have such a robust set of nurses working with us here in Milwaukee County. Mayor Barrett mentioned some of the election data. I'll just talk about that a little bit more since it came out from the epidemiological team. We had 54 cases. I believe that the mayor may have 6.
It's fine. Is this what the email you sent yesterday?
Thank you. So 52 of those were actual voters and 2 were poll workers. In terms of 26 of those individuals were symptomatic prior to the election, and the other 26 were symptomatic after. What that indicates to us is that some of those individuals were infectious before they voted. Some may have been infected while they were voting, and others may have been infected through activities not related to the election. Really, at this point in time, we have an inconclusive relationship between the election that took place on April 7th and the spread of COVID-19. Now, that being said, as the Mayor Barrett pointed out, there were a lot of mitigation measures and protection measures put in place to prevent the spread of COVID-19 during the election. High utilization of PPE, that personal protection equipment, was there for many of the poll workers as well as a lot of the voters. We saw a lot of social distancing accommodations with people being spread out by 6 feet. So the elections themselves, we did a very good job in terms of putting these public health measures in place to minimize the spread. And I think that we're seeing that show up in some of these analyses of what happened after the election. A couple of other public health messages to put out there. One is on testing. I know we've just talked about testing and the expansion of testing. In looking at our data, one of the key benchmarks that we're looking at is the percent of our cases that are coming back as positive for COVID. The Badger Bounce Back plan has a threshold or benchmark of 10% of our cases. Within the last week, we've seen an increase in this percent positive. Right now, we're hovering at about 23% for the last 3 days. So that's higher than it's been in a while. The week ago, during the same time frame, it was about 12%. So this is an indication that we are needing to, again, continue to ramp up testing for people so that we can reduce that percent positive number. And we're making great progress in getting more testing sites up and running to, again, reduce this percent positive number. But this is an indication that the virus continues to spread throughout the community and that we need to take the measures that we have in place and continue to practice them and not let up on our social distancing and protection measures that we have in place. With regard to testing, the message today is that everybody who has signs or symptoms of COVID should be able to get a test somewhere. The first line is to contact your healthcare provider and determine where you can get tested through that healthcare system. If you're not able to get tested in that way or you don't have insurance, 211 is another avenue for you to call and to learn about where you can be tested. As mentioned, there's a number of community sites around Milwaukee County as well as the region where you can get tested. And we want everybody with signs or symptoms to be tested so that we can have a true sense of what our disease is looking like in our communities to make determinations about whether we're making an impact or not. And the only way to do that is to make sure that everybody with signs or symptoms has a test and we're able to know what's truly happening. So please do go get tested if you have those signs or symptoms. And then my last public health message today is that on Monday, CDC changed their guidelines for people with confirmed COVID-19. Prior to this, the recommendation for a period of isolation was 7 days and 3 days of improved symptoms. CDC on Monday extended that to 10 days and 3 days of improved symptoms. So that isolation period, if you do have COVID, will be longer than it had been. The reason for that change is more understanding about infectiousness while you have COVID-19 and that duration of time that you might be infectious. So if you have COVID-19, you're likely in touch with one of those amazing public health nurses that I mentioned, and they can help you determine when you'll be released from isolation if you have COVID. So again, they can help manage what that timeline is for you based on your own signs and symptoms and the duration of those symptoms. So please be in touch with your local health department. We're here to help support you in this difficult time. Thank you.